Welcome back to West Texas View.
We were talking before the break about some of the things that go on with some questions that we've been asked. And another question that we've been asked is for him to expound more about ADHD in children, and particularly in minority children. And talk about that for a minute.
Well, it's a very, so we had known about this happening for some time. This study has come out to be more emphatically emphasizing the fact that we tend to overlook ADHD symptoms in minority kids. That doesn't mean that the diagnosis of ADHD is less in those minority kids. It's just that there is a bias against diagnosis and hence getting them adequate treatment in minority kids. That's what the study is emphasizing. It's more for the physicians to look out for those symptoms. And I can give you some practical examples for it. And this is also very cultural and racial. And I'm going to say, give an example with due respect to all the ethnicities and cultures that we have. My intention is not to insult or anything. I'm just giving you a scientific example over here. That in certain cultures, particularly in my own South Asian culture and say Hispanic culture, where the freedom for the kids to be more physical and do around is very much acceptable. Like for example, two mothers sitting there gossiping certain things, and they have two boys. It'll be okay for the mothers to to let the boys go around in the house, do things, and being boys, they can be intrusive here and there, and the mother will not be very frazzled. So it's a more culturally acceptable way in particularly South Asian and Hispanic cultures for let's say they have higher tolerance for kids to be more physically active. Now when these kids go to say a mainstream Anglo-Saxon predominantly Protestant white cultural schools, where the expectancy for the kids is very different. Sit down when you've been told to sit
orderly.
down. Yeah, you've been told to sit down and you're told to do certain tasks. You're required to do a task, and while you're doing a task, you're not supposed to do this thing, that thing.
To wiggle or move.
No, you're not allowed to do that. So when it comes to for kids, this is a very sudden, dramatic change. I'm not saying every kid has a problem. I'm saying most of the kids.
By and large.
Yeah, by and large, they have problem. So that's one way of having. So kid definitely will have more problems. So when I particularly get referrals from teachers saying, okay, teacher telling the parents, this kid may be having ADHD, and I find the kids from the minority, I have to be very careful finding out whether does it really mean the kid is having need to take medications, or is this child is just confused, saying that, hey, I'm able to do more around and do my homework and run around in my house. I don't get it when I go to school. Why can I do it? As you know, so it's something the kids are a little bit confused. It tends to be a little bit more, less of a problem in older kids, where they have learned over the years that you can behave in certain way at home, but you're required to behave in certain way at school, for example.
And so they get frustrated when they're allowed to do it here, but they're not allowed to do it here. And so yeah. And you certainly don't want to medicate them for something that they don't have.
Right, they don't have it. This study is actually emphasized on the underdiagnosis of ADHD in minority kids. There have been other studies who have actually cautioned about just the opposite, particularly in minority kids. This example I was telling you, that is it possible that minority kids are being overdiagnosed with ADHD when all the kids is doing is what they're expected to do or tolerated to do at home. So it can go both ways.
But the other another question that came in about the children when you were here one other time was about autism and how difficult that is to diagnose, and how difficult it is because it kind of mirrors other problems.
Yes, autism particularly is extremely difficult to diagnose unless it's very flagrant or obvious, because autism can
take a lot of forms.
Right, it can vary forms. At one end you see extremely dysfunctional, very mentally retarded, someone very aggressive, not able to function at all, compared to at the other end of the spectrum they are very high functioning, and unless a trained eye sees them, they cannot be detected. And these only come to the physician's attention because they're having problems, say, interacting with kids at school, they're not understanding sarcasm, they're getting frustrated very easily, or they are being brought to attention because of the what we call comorbid conditions that go along with autism. Say, for example, either mental retardation or seizure problems, or very commonly ADHD. So not able to sit still and do this. When we find them to have ADHD and then we assess them very thoroughly, we find, guess what, this child has autism, and it may also manifest as behavior problem because autistic kids not able to understand what's going on in their environment, how they're interacting, what does that mean to have certain form of social cues. They may respond to it aggressively, irritably, and that's how they come into attention because of behavior problems.
And so, or they maybe just fold themselves back into themselves.
Yeah, it's possible that because they don't feel accepted and validated by other people, they tend to develop, seclusion, and this how.
Well, talk about the medication, because I know we hear a lot of really negative things about people are over Ritalin, and so are the medications improving for those kinds of children's mental health problems?
Well, let's talk about it very carefully about let's see who we're talking about. Now, there is no medication treatment for autism.
For autism.
For autism, there is no medication treatment. Now, the symptoms that go along with autism, for example, depression, anger, irritability, inattention, distractibility, now those can be addressed by medication. So, and that's where the parents get very frustrated that they are coming to see a psychiatrist hoping that the psychiatrist will cure their child. But of course, this is a genetic condition, it's an inborn condition. There's no cure for autism. But having said that, a child with autism can be trained to be more functional. If we control his aggression, control his mood, the child can be trained to be as functional in most cases as any child can be. Mild to moderate form of autism, they can be trained, they can be taught some form of vocational training. So nowadays, with more early detection and more comprehensive approach to their intervention, we are able to get more and more these autistic folks to have independent living, self-sufficient living.
We're going to have to take another break, and we'll come back for the final segment of our series of programs with Dr. Bobby Jain, psychiatrist with the Texas Tech University Health Science Center. See you in just a minute. Now this.
Stay tuned. West Texas View will be right back.